Hi everyone, this is Yodit. In my fifth Tiltw, I'll be reflecting on my week back at the hospital and talking about some goals for the last week of this rotation. Overall, I think rounds went so much better this week when I compare it to my first 2 weeks. I found that I was much more confident and I was prepared, which really helped. Just to talk about rounds real briefly, as soon as we got back on Tuesday, since we weren't in on Monday, I introduced myself to the medical team and I reintroduced myself to my medical intern and just oriented her to the fact that I would be replacing Justine and I'd be working with her for the next 2 weeks. Additionally, when we had medical students, even just there for the morning, I made sure to introduce myself and I asked about their program and they asked about ours. Some improvements that I noticed in myself during rounds is I'm getting much better about saying days of therapy, antibiotic therapy, and mentioning what was continued from home, what was added, and what was changed, because that was really important to our resident. Additionally, paying attention to when we're going over GIS patients were really came in handy for me for a lot of things. I think it's just a great opportunity to learn, but I know one instance in particular where they were having a thoughtful discussion about other causes of chest pain, so I just started writing down kind of the differential and what they mentioned. Dr. Carlson added that GERD is another factor. And later on that night, the patient that I worked up for farm rounds had chest pain as their chief complaint, so it made it a little bit easier for me to kind of go through my assess, but it was also just a good opportunity to reinforce knowledge as well. Some things that I'd like to work on with rounds would just be keeping in mind a patient's total 24-hour pain med amount, because that is much more helpful when we are reading the meds to say this is how much they received in the last 24 hours versus what they received today to see if we need to assess their regimen. And I think a big takeaway that came up is that when something acutely happens in the hospital to a patient, we as pharmacists should always be thinking, did a medication cause this? It happened twice with my patients this week, or at least twice that I can remember, where a patient was consistently spiking fevers and the team was kind of at a loss as to what was going on, and we had to kind of assess, is this drug-induced? And then similarly, when I did pre-farm rounds this week, and I was looking at all of the different things that could cause elevated liver enzymes, just really assessing if a medication, the patient had been on a lot of antibiotics, if any of those could have been offending agents. And overall, I think I was much better about speaking up on rounds related to dosing and relevant information. Like I said, during pre-farm rounds, I went through all of the medications to see if any of them were causing elevated liver enzymes. And when that came up again on rounds, when the team was just like kind of stuck, I just talked out a little bit and said that I'd actually gone through all of the medications she would have received, and none of them, given like the time frame or their properties, would have been the cause in this case. And then related to farm rounds, so I did 2 this week, and I think it was less anxiety producing than the first time I did it by far. And I think one thing that helped was the fact that I worked up patients kind of Saturday, but mostly Sunday, and going through all of the different things that we do when we work up, but I think I'm just getting more familiar about, should I be checking, is the patient indicated for heparin? Why are they IV versus PO? Was this the appropriate conversion? I think there's questions that start coming up as I'm going through the chart, which the first 2 weeks of rounding, I was still kind of unclear, or I guess not as confident in myself to pick up on those things, but working up my patients on Sunday, identifying interventions, and coming prepared to talk to Dr. Carlson in the morning really helps me get a lot more out of rounds as opposed to waiting. And I think that was actually one of my favorite pieces of advice from the Twitter thread that I had asked people what they would have told their API yourself, and just being confident in the safety net that we have as API students. And even if you're not sure, just to write it down and talk about it, because this is the best time to be wrong. And this time around, I didn't have any analysis paralysis, which was a big concern the first time I did farm rounds. I just chose the patient I was going to do, and I worked them up. We didn't go in on Monday, but I knew my patients well. By having worked them up on Sunday, it was more like updating them throughout the week and then doing my farm rounds for 2 patients. I think moving forward for the next one, I just want to be a little bit more time efficient, as it's still taking me upwards of 5 to 6 hours. And then I think just overall being more thoughtful about when we're going through the problems one by one. I think it's easy just to be like, okay, this is AFib and this is heart failure, versus when we are talking about it during farm rounds, maybe there is a reason that we chose one over the other because of this factor, and thinking of more the big picture versus every problem as its own. And I thinking of an example would be a patient that had heart failure, AFib, and they were on a steroid and inhaler, but we weren't sure the indication. However, if knowing that, the patient may have had some kind of respiratory issues, which would lean us more towards the selective beta blockers. So when I was assessing carvedilol versus metoprolol, that could have been another justification that I used. I think another thing that I did this week was citing primary literature in my farm rounds. So I used like the RAILS and the Ephesus study for patients with heart failure to justify using spironolactone versus eplerenone. And again, just being better at doing it in a more timely fashion would be the goal for the last farm rounds and pre-rounds that we have. Some other things that I've been working on this week, I made 2 infographics, one about just advice for APPEs and another one about medications to be avoided and myasthenia gravis. And I think not only is it fun because we've all done infographics at this point almost, but it also really reinforces your learning, and I think it's just aesthetically pleasing. So I'm a huge fan of Piktochart. And lastly, some things that I want to continue, start, and stop. So I will continue working on FPP this weekend and to be prepared for next Thursday, and I'll use kind of the system that I have that's been working for rounds and continue to work ahead on patients. For start, I want to start practicing for the final patient presentation, working on things that have been identified as areas of improvement, and hopefully just making my presentation very solid. I will start working on my midpoint eval since that is due sooner this time, and then working up my patient for farm rounds on Sunday. And then for stop, again, just saying so or speaking as fast during my FPP, but additionally stop spending as much time working up patients. So like I said, still took me kind of a long time with the farm rounds that I had this week, so I'd like to get it down maybe by an hour or 2 if possible. So I think that's it for me. I'm looking forward to this last week of rounding and also doing my own FPP and hearing everybody else's as well. I will see you all next week.